Many chronic heartburn sufferers prefer an alternate, natural way of treating their acid reflux. This acid reflux treatment may range from home and homeopathic remedies to healthy diets and making lifestyle changes. Medical acid reflux treatment for gastroesophageal reflux disease (GERD) is intended to reduce the abnormal reflux of stomach acid and juices into the esophagus, thereby preventing injury to the esophagus lining or helping it heal if the damage has already been done. Ongoing acid reflux treatment is vital for preventing GERD from recurring and other conditions that might arise as complications of acid reflux disease. Untreated acid reflux may lead to severe complications, including esophageal cancer. Suggested treatments given below are some of the recommended acid reflux treatments for GERD. As always, it is imperative that you discuss the acid reflux treatment alternatives with your healthcare professional. Making changes in lifestyle. One of the very first steps healthcare professionals counsels their patients during acid reflux treatment are lifestyle changes, like quitting smoking, abstaining from alcoholic beverages, eating less but more often etc. Heartburn symptoms can often be relieved if the patients to put into effect a few of these lifestyle changes. Diet control. Nearly 90% of sufferers link their acid reflux symptoms to specific foods. Thus, it is essential that the patients control their diet or intake in order to treat their heartburn. There are foods that are usually safe for heartburn patients to consume and that have little risk of triggering an acid reflux reaction, while some specific foods must be avoided, as they cause heartburn to occur. Over-the-counter remedies. Acid reduces. This type of acid reflux treatment works by reducing the amount of acid the stomach produces, and are generally used to treat conditions in which acid comes up into the esophagus and causes heartburn. Antacids. These antacids work by neutralizing acid in the stomach. Antacids neutralize stomach acid on contact and relieve heartburn. This acid reflux medication is usually tried first when symptoms are infrequent and mild. Prescription medications. Proton pump inhibitors. Proton pump inhibitors (PPIs) are a group of prescription acid reflux medication that prevents the release of excessive acid in the stomach and intestines. Healthcare professionals generally prescribe this type of acid reflux treatment for people suffering with severe heartburn, ulcers of the stomach or intestine, or excessive stomach acid referred to as Zollinger-Ellison syndrome. Prokinetic agents. This type of acid reflux treatment is used to improve GERD symptoms for patients with slow gastric emptying. They speed digestion or increase the rate at which the stomach empties, which prevents acid from staying in the stomach too long. Fundoplication. Fundoplication surgery is the most common surgery used to treat GERD. This surgery involves strengthening the valve between the esophagus and stomach lower esophageal sphincter, which keeps acid from backing up into the esophagus as easily. Enterics injections. The enterics procedure involves the use of a polymer device and a solution that is injected into the lower esophageal sphincter during an endoscopy. The injected medication forms a spongy mass that reinforces the lower esophageal sphincter to prevent stomach acid from moving into the esophagus. Stretter procedure. The Stretter procedure is the most acceptable acid reflux treatment. This non-surgical procedure uses radiofrequency energy delivered through an endoscope to tighten the lower esophageal sphincter. The Stretter procedure is relatively modern, and till date has caused complications in less than 1% of the patients. Alternative treatments. These acid reflux treatment ranges from home and homeopathic therapies to healthy diets and lifestyle